We're currently at the lung screening programme within one of our Sandwell sites. We scan here for around 5 to 10 days a month, every month. When the patients arrive, they'll be greeted by one of our healthcare assistants who will take their height and weight. They'll discuss what the appointment is going to entail, and then they'll be contacted by the nurse in the next room. They'll discuss past medical history, smoking history, and then eligibility for the scan. When they go in for their scan, they'll go through consent with the radiographers and sign a form, and then they'll have their scan, which normally takes about 3 or 4 minutes, and they'll get their results after that, which generally is within about 2 to 4 weeks.
My name is Babu Naidu. I'm a professor of thoracic surgery at the University of Birmingham. As a clinical lead of this program in Birmingham for lung cancer screening, to commission a service for lung cancer screening in itself was really to improve outcomes for the Birmingham population. We'd heard some great things about InHealth, and we explored them as a provider.
I'm Jonathan Ferguson. I'm a consultant thoracic surgeon at the James Cook University Hospital. The reason why we commissioned an independent provider to provide our target lung health check screening was the speed of which they could deliver the service, the quality of the service.
We work with a hospital trust. We will contact and extract data from local GPs who are participating within the programme. It's all the patients that are identified as high risk at the point of like a telephone triage assessment, and then they'll be invited here if they're deemed to be at high risk.
The best bit about InHealth's delivery of lung health checks is their sensitivity and the way that they interact with patients, with families, with GP practices, with GP nurses, with tertiary referral centres and with surgeons like me.
It's a great job. I absolutely love it. I love seeing the patient pathway and following them through that journey to like the outcome, working with the people that we work with in the hospital to see the patients all the way through the pathway is really rewarding, yeah.
Being a lung cancer surgeon, I operated on someone just yesterday who came through this program. Her experience of this whole process was, she was grateful for it. The cancer's been picked up early, small, she's had a curative robotic surgery, and she'll probably go home tomorrow. I think that really is the final test, if you want, that this whole process is working well.
I've been a consultant for 17 years now. Up until the point of this programme, 80% of lung cancer was palliative, 20% was curative. What comes off the InHealth lorries is 80% curative and 20% palliative. That's what makes the difference.
My name's Katie Lee and I'm Project Manager for lung cancer screening across Nottingham and Nottinghamshire. Since the programme began in April 2021, we have performed over 45,000 risk assessments. We've done over 30,000 scans out in the community and diagnosed over 350 cancers. And what this means for our patients is that we can give more people curative treatment and improve lung cancer survival rates.
The national average is roughly about 40% for the uptake in terms of the number of patients who actually will come forward to have it done. But from the InHealth perspective, it runs in our area about 70%. That means we're almost doubling the amount of cancers we can find.